Hi, it's Dr. Zenn. I'm here to tell you that you do not need eyelid surgery or a blepharoplasty. You don't need it. I can't tell you how many people come in to see me because they want some skin removed from their eyes, they want their eyes done, and that's not what's going on. What's going on is that their eyebrows are so heavy, they're literally pushing on their eyes. How do I know? Because when I examine them, I will raise their eyebrows to a nice, beautiful, aesthetic position above the orbital rim, above the bone of the eye socket, and like magic, there is no extra skin anymore. So how do you know you might need a brow lift? Well, you may have problems when you put makeup on. You literally are pulling up your eyebrow and putting your makeup on, and then you're letting go, and guess what? It just disappears. Or you may find that you have really deep wrinkles to your forehead. What those wrinkles are from is because your eyebrows are so low, it starts to block your vision. And when you don't think about it, you're automatically, the muscles of your forehead are literally pulling up your eyebrows all the time to open that field up so you can see everything. Sometimes people will tell me that, they wanted to get rid of their wrinkles, and so they went and got some Botox. What Botox does is Botox will paralyze muscles that are causing wrinkles, so their forehead gets smooth, and guess what happens? The eyebrow goes even lower. So if you have a low eyebrow and you're working overtime to hold those up, you are just not a candidate for Botox because we need those muscles to hold things up. What is the treatment? The treatment's a brow lift. So how do I do brow lifts? I do brow lifts like most board certified plastic surgeons. The ASPS just put out a survey to plastic surgeons who are board certified saying, how do you do brow lifts? 86% said they did an endoscopic brow lift. Endoscopic brow lift are some small hidden incisions in your hair so no one can see the scars. Use an endoscope to go and literally just release the eyebrow, and it gets reset, and I secure it in a cosmetic position, which doesn't make you look surprised, but makes you look relaxed. And it's a nice beautiful arch to the brow, and that cleans up those areas of the upper eye. Now sure, some people still need a little bit of skin removed, but skin is not the issue. In fact, people who go and have skin removed when their brows are low, you can't even see a difference because that's not the problem. The problem is the eyebrow. The other thing we'll do is that because we know that faces deflate as we age, not only is the eyebrow coming down toward your eye, it's also coming in as we're losing fat. If you look at your pictures of you when you're youthful, or you look at maybe your kids, you see their eyebrows are low, but they're sitting on a nice little mound of fatty tissue, and as we age, that completely disappears. So not only will I raise the brow, I will go ahead and place some fat under the brow as well. Now, some people have been offered different things for brow lifts. You can have your brow lifted by literally cutting out some skin above your eyebrows. I've seen some pretty bad scars that way. It's in an area that's very noticeable, so it might pull the eyebrow up, but now you have these scars that look terrible, and how are you going to hide those versus a hidden scar? What's becoming more popular now is a side approach. It's called a lateral or temporal brow lift, where a hidden incision is made on the side. And I think those can work well when all you want is a little bit of lift of the corner of the eyebrow to give it that nice little aesthetic kick. Sometimes we can get that with Botox. But if you have a heavy brow and it's covering the eyes and you're thinking you might need a blepharoplasty, then you need a surgery that's going to lift the entire brow, and that would be the endoscopic brow lift. So, if this sounds like you, deep wrinkles in your forehead, problems putting makeup on, a brow that's super heavy, you might need a brow lift. Come see me at Zenn Plastic Surgeon. We can take a look at everything and see what you really need.